Welcome to the University of South Carolina College of Pharmacy Podcast, our first podcast of 2025. I'm your host, Margaret Gregory, and we're pleased to have Dean Stephen J. Cutler join us as we kick off this new year and talk about the many exciting things ahead for the college. Dean Cutler, thank you for being with us today.
Thank you, Margaret. It's a tremendous pleasure to be with you, and I want to wish you the best of 2025 as we enter into the new year.
So first, I'd like to take note that you have dual roles here at the university. Not only are you Dean of the College of Pharmacy, but you also serve as Vice President for Economic Development for USC. Talk a little bit about what that role involves and how you manage your time between the two.
Thank you for that question, Margaret. So first, I have to say that being the Dean of the College of Pharmacy is just such a tremendous pleasure for me. It's a remarkable program. It's one of the best in the country. I've worked at 4 universities, and this is by far the best college of pharmacy that I've ever been associated with. This past February of 2024, the University of South Carolina Board of Trustees elected me to serve as its first Vice President for Economic Development for the University of South Carolina. And in that role, I get to serve as an advocate for the university, an advocate that helps to support the advancement of intellectual property or the cultivation and development of small businesses or mid-sized businesses and large businesses. Part of this includes the recruitment of some of these businesses into the state of South Carolina. Some businesses are coming from within the United States, while others are coming from outside of the United States. Specifically, as it relates to my role as Dean of the College of Pharmacy, it allows me to facilitate the cultivation of collaboration within the College of Pharmacy. And what do I mean by that? Well, we have individuals who wish to grow small businesses in South Carolina that are trying to develop technologies that could be used in a pharmaceutical setting. I have an example of an individual who's developed a compound that will slow down the progression of Alzheimer's and is looking for a clinical partner. And in that particular case, I've linked him with Lauren Hofseth, the college's Associate Dean for Research, to advance that particular product through clinical trials. That's just one example. There are many others in which I'm facilitating and coordinating the activities of the faculty within the College of Pharmacy. But I also do this with other colleges across campus, and it's not just in the health sciences. Within the health sciences, that includes the College of Nursing, Arnold School of Public Health, the College of Arts and Sciences, as well as social work. Outside the health sciences, some of this includes work being done also within the College of Arts and Sciences, but in the non-healthcare areas, and more importantly, work being done in the College of Engineering. I'm thrilled that the Board of Trustees elected me into this position, and I'm also happy that I'm able to facilitate the development of the College of Pharmacy with this new role.
In serving in these two roles and then also trying to have a life outside the college, one of the things that we always talk about is that work-life balance for our students as well. How do you manage that?
Well, that's a good question. So managing work-life balance is important for everybody. In my particular case, what I do is I budget time for those two roles, and I try to make sure that I'm meeting the needs of both the College of Pharmacy and the Office of Economic Engagement. But I also take time to fish and golf and then spend time with my family, which is very important to me. So I am able to find time to spend in the outdoors, which I enjoy so much, while at the same time balancing what the needs are for the College of Pharmacy and for the University of South Carolina.
And I know that's something that it's important to set that model for our students to understand. That's one of the things that the college wants to be able to provide for them, is we understand everything that goes into being a pharmacy student, but also to have that outside life balance.
It's so important for our students to understand the significance and the importance of balancing what they're doing as a student pharmacist with their lives. And so this is something that I point out to students whenever I get the occasion.
One of the things that's coming up in the next couple of months that the college will be undergoing is its evaluation by the Accreditation Council of Pharmacy Education. So let's talk a little bit about what that means and what it takes to actually prepare to undergo that evaluation.
I love the question because this is so important for all our listeners to understand. The Accreditation Council for Pharmacy Education operates under the auspices of the United States Department of Education. A school or college must be accredited, otherwise the students cannot sit for the North American licensure exam. So a school or college, in order to recruit students to train them to be pharmacists, must be accredited by ACPE. So the accreditation process is one that's fairly lengthy, and it's designed to evaluate a program in a very thorough and complete manner. We have been working on the self-study, which is really a self-reflection of the college, for almost 18 months. And the process is one in which we look at the administration, we look at our curriculum, we look at other things, including the facility. Who are our preceptors? What does our experiential education look like? And how are we assessing our program? In addition to that, they also want to evaluate the financial resources that the college has. So it's a fairly thorough report. I would say that probably the number of pages of the report, including uploads, is over 1,000 pages. However, it's important and it's necessary that every school and college in the United States that operates under the accreditation standards of the American Council for Pharmacy Education undergoes this sort of a process. It helps us be better at what we do, and ultimately that's developing a better student pharmacist, a better graduate, and a better practitioner. And since we're developing students at a high level at the University of South Carolina College of Pharmacy, and when I say a high level, I mean they're one of the best pharmacists in the country. And by default, since the United States is one of the best health care countries in the world, we're developing one of the best practitioners in the world. So we welcome the site visit, which will be in 2 months. They'll be here in March, and that team will evaluate not only the report that we provide, but also through interviewing students, staff, and faculty to ascertain how well we're doing. We look forward to getting a full accreditation, which is typically an 8-year period of time.
I'm looking at this from the standpoint, this has to be an all-hands-on-deck type evaluation. So what do faculty and staff, what are their roles as part of this evaluation?
So the faculty and staff are instrumental in this process. Actually, the self-study report is from the faculty and staff. It's not the administration. It's not the dean's report. It's not the senior associate dean's report. It's the report of the faculty on the health of the College of Pharmacy. So they have played an instrumental and vital role in the preparation of this self-study. They have drafted the reports, they've refined those reports, they've vetted those reports, and they have voted on those reports. So it's really driven by the faculty and staff of the College of Pharmacy.
You recently penned an article for the South Carolina Pharmacy Association's regular publication, Palmetto Pharmacist, and that particular topic talked about the challenges that face the profession and how we are preparing our students for their future careers. What do you see as some of the biggest challenges that face not only the profession, but our students as they go out into that world?
Well, there are many, and I certainly won't address all of them that I see, but I would say that the top 3, 4, or 5 would include a shortage of pharmacists. We have declined enrollment numbers across the whole United States. It hasn't impacted the University of South Carolina College of Pharmacy like it has other schools or colleges of pharmacy, and part of that's because we have put in differential advantages in the education and training of our students that most other schools and colleges of pharmacy don't provide. A couple of quick examples. We have the Kennedy Pharmacy Innovation Center. This is where we train students to have an entrepreneurial spirit. We also have the Walker Leadership Scholars Program. This is a high-end program that teaches our students how to become effective leaders in the field of pharmacy on a national level. We also have one of only 4 or 5 schools or colleges of pharmacy, a poison control center that's housed within the College of Pharmacy. And there are other things that we're doing, including a new initiative that will help us train those pharmacists that wish to own their own pharmacy. An independent pharmacist is a real critical and vital area for all of the United States, but these are the individuals that really provide tremendous support in the healthcare arena in most of the rural areas in South Carolina. And so we're going to provide those students an opportunity to understand what it takes to own a pharmacy. We're going to do it soup to nuts. That is, they're going to know exactly how to look at a store, how to value the store, how to control inventory cost, how to control costs associated with payroll and fringe, personnel costs in particular, and then who are some of the best partners to align with so that they can get better pricing through wholesale markets. And so these differential advantages, I think, have helped us avoid a reduction in enrollment of students like we've seen at other schools and colleges of pharmacy in this area and in the southeastern part of the United States. That's one area that I see as a concern. The other is the effect that the pharmacy benefit managers are having on independent pharmacies in particular, but also individuals who are within an insurance program in which a PBM regulates their prescription products. I see that as a growing concern, and regulators are also beginning to see this. In the state of South Carolina, we saw Senator Cromer lead a group of individuals, mostly independent pharmacists, to implement changes in how PBMs can operate in the state of South Carolina. On a national level, we have 2 pharmacists that serve in the House of Representatives until the 119th Congress, which just sworn in its 3rd pharmacist. And so these individuals are now able to serve as an advocate for independent pharmacists, to educate their colleagues on what PBMs are doing, and to begin regulating that particular area of business. Another area of opportunity, I was going to say concern, but opportunity, is the expansion of the role of pharmacists. What the ACPE is doing, the Accreditation Council for Pharmacy Education, who we talked about a moment ago for our self-study and accreditation of our college, they're now asking for schools and colleges of pharmacy across the U.S. to train students a little bit differently in the sense of being able to diagnose and dispense medications without the physician or physician assistant being involved. Now, this is an area of opportunity for pharmacists, an area of opportunity to provide services that might not otherwise be available in that particular geographical region. I see these as some of the concerns. There are many others, but these are some of the most important talking points, I think, for pharmacy and the future of pharmacy in the state of South Carolina, as well as across the United States.
You talked about how we're preparing our students to go out into the profession itself, but I think one of the things that I've learned that's also unique about our college is how we prepare our students to not only be providers of healthcare, but also in their roles as advocates and as leaders in the profession. Talk a little bit more about how we do that.
The Walker Leader Scholarship is an incredible program. This is supported by an alumna, Donna Walker. She's just a remarkable individual, and she has a vision in training students at the University of South Carolina to be effective leaders on a national level. Well, when you have that, you got a trickle effect where those individuals want to share their education and their experience with other pharmacy students. And so what we see is a flywheel effect happening in which leadership training is really growing. It's growing at an exponential rate. And with that, to serve as a leader, one has to also accept the fact that they're going to serve as an advocate. And this is one of the things we try to do with all our students. We're interested in helping them cultivate and developing their advocacy skills. And we can only have to look to the most recent national meeting that was hosted in New Orleans in December, where we had many students engaged in leadership development and serving as advocates. One of the really great examples is one of our students, she's a P4, Kendall Kerr, accepted an opportunity to go to Washington, D.C. and serve as a student pharmacist advocate for changes in the practice of pharmacy. It was an incredible experience for her. It was an incredible experience for the other students from other schools and colleges that were there. And it's just a really wonderful example of how we're developing our students to serve as leaders and to serve as advocates for the profession.
A lot of times I hear people talk about the engagement of our alumni in our college and how they're so engaged in what's happening here. And I know that's something that's very important to you, because in preparing students to be leaders and advocates, it also means that our alumni have to be participatory in that as well. Talk a little bit about how you see the role that alumni play in supporting our students?
This is one of my favorite conversations. We have a remarkable group of alumni who want to be engaged in the education of our students. They want to be engaged in the development of our college. And I think many of them look at the time when they were a student and the impact someone else had on them. One of the things I note is when we have a scholarship dinner where some of our donors are able to interact with the students that they're supporting, that they now have a different appreciation for what it is that they are doing in the support of our students. As we talk about the development of differential advantages, including, let's say, training students to be independent pharmacists, should they wish to engage in that area of practice, the alumni base is going to be very critical and vital to that, because these are the individuals who have the experiences in owning and running an independent pharmacy. And so their input in the development of our students as mentors is going to be vital for the success of that particular differential advantage. I'm so thrilled to work with the alumni of the University of South Carolina College of Pharmacy.
What advice would you have for students who are considering the possibility of a career in pharmacy? What are some of the things that they need to think about, and what would you tell a student who's considering coming to the University of South Carolina College of Pharmacy?
Well, I love the question, because this really ties up some of the questions and answers that we've had during this podcast. So we have differential advantages that offer almost a tailor-made education for a student wanting to earn a PharmD degree. If a student wishes to develop entrepreneurial spirit, if they wish to develop leadership skills, if they wish to own their own independent pharmacy, if they wish to understand poison control and toxicological effects of not just medications but other products, and I could go on with other examples of what we have as differential advantages. We will tailor-make almost to the specific desires, interests, and passion that individual has. And I don't think any other university across the United States can offer such a diverse education to specific single needs or desires that a person has than if they attend the University of South Carolina College of Pharmacy.
And I think that's one of the things that many students learn when they get here, is that there are so many opportunities for types of careers that you can experience in pharmacy. What are some of the things that you think students may not be aware of when it comes to a career?
So this is something we see with many of our students. They will come to the University of South Carolina College of Pharmacy with an idea what they want to do. And as we expose them to some of these things that I have discussed and mentioned earlier, they change their mind. They've found something that they are more passionate about. And there's nothing more rewarding than to see a student see something that they didn't know existed and to unleash a passion. I will add this too. One of the differential advantages that we have as a college is it's a family atmosphere. When students enroll here, when they come into the first day of classes, they're not considered a student. They're considered a colleague. And I don't think there are too many other schools or colleges of pharmacy in the country that treat students the way we do. We want them to feel comfortable when they go out on the experiential rounds and serving as a member of the healthcare team. And we do that by cultivating them on the first day as being a colleague.
Dean Cutler, thank you so much for spending some time with us. It's been a pleasure talking with you today, and thank you for sharing your insights about how the college is moving the profession forward, ensuring that our students are prepared to be tomorrow's innovators and leaders.
Margaret, thank you for this opportunity. I'm so grateful for it, and keep those spurs up.
And thank you for joining us for this edition of the USC College of Pharmacy Podcast. Remember, you can listen to past episodes or join us for future podcasts on iHeartMedia, Spotify, and YouTube.